Today for my teaching on incompetency, I'll be talking about chronic traumatic encephalopathy, or CTE. Today for this presentation, I will be using visual aids throughout my presentation. So in a face-to-face setting, I will ask some assessment questions asking what is CTE, why is it important we understand what CTE does, how is CTE diagnosed, and who is at higher risk for CTE. The goals of this competency would be for the participants to understand what CTE is. They will be able to explain what CTE does, what part of the brain CTE affects, why is it important to be able to diagnose CTE quicker, who's at high risk for CTE, what the signs and symptoms include. To evaluate the effectiveness, I will be asking some post-session questions. So CTE stands for chronic traumatic encephalopathy, which is a degenerative brain disease. When CTE was first described in 1928, it was described as having punch-drunk syndrome. CTE affects the corpus callosum, the mammillary bodies, hippocampus, medial temporal lobes, and frontal lobes. So the corpus callosum is part of the mind that allows communication between the two hemispheres of the brain. It is responsible for transmitting neural messages between both left and right hemispheres. The mammillary bodies are important to record memory. The hippocampus is a major role in learning and teaching, mediating declarative memory. And then the temporal lobe parts is part of the hearing, memory skills, and language. The frontal lobes are part of the brain that controls important cognitive skills in humans such as emotional expression, problem solving, memory, language, judgment, sexual behaviors. It is essentially the control panel of our personality, enabling an ability to communicate. So there are 4 stages of CTE. In stage 1, you have only symptoms that include headaches as well as loss of attention and concentration. Stage 2 is where the CTE find themselves suffering from depression and or mood swings, explosivity, and short-term memory loss, in addition to stage 1 symptoms. Although less common, other stage 2 signs include excessive dysfunction, language difficulties, impulsivity, and the potential for suicide. Stage 3, executive dysfunction, memory loss, explosivity, difficulty with attention and concentration begin with those with CTE when CTE reaches stage 3. Additionally, those signs with stage 3 also develop depression or mood swings, visual-spatial difficulties, and aggression. Headaches, impulsivity, suicidal symptoms have also been noted, although lesser extent. People with stage 3 were considered cognitively impaired, according to a study. And then in stage 4, the most severe stage of CTE. Those with stage 4 suffer from executive dysfunction and memory loss initially, and then develop severe memory loss with dementia. Researchers have found that most people studied with stage 4 also developed a profound loss of attention and concentration, executive dysfunction, language difficulties, explosivity, aggression tendencies, paranoia, depression, gait, and visual-spatial difficulties. To diagnose CTE is almost impossible to do until the patient is dead. So the doctors can do some tests and kind of rule out some diagnosis, but they cannot be for sure until the patient has already died. To check for CTE, the doctors will compare the changes in a normal brain, people that have Alzheimer's, and patients that have CTE before to correctly diagnose CTE. So, as right now, there's no treatment to cure CTE. If the doctor suspects that the patient might have CTE, he might recommend behavioral therapy to help with mood swings, pain management, and memory exercises. If the patient follows the doctor's recommendation with the therapies and memory exercises, the patient will be in less pain and not seeing mood swings and can slow memory loss. So CTE has been found in boxers, football players, soccer, ice hockey players, military vets, and victims of domestic violence. And then athletes with longer careers playing contact sport are at higher risk of having CTE. So some signs and symptoms of CTE will include memory impairment, attention and concentration loss, diminished ability to make decisions, poor judgment and impulse control, irritability, irritability, hopelessness, and apathy. And then we have aggression, depression, suicide, difficulties with walking and balancing, slow slurred speech, focus system, which is tremor, rigidity, and slow movements. Then we have chronic headache, mood swings, and then regular headaches as well. So CTE is a degenerative brain disease found in people who have a history of repetitive brain trauma. There are 4 stages of CTE, with stage 1 having early on symptoms and stage 4 being the most severe. CTE is higher in people who have a longer career in a contact sport, so as in football, boxing, UFC, MMA, fighting, stuff like that. CTE cannot be diagnosed until death, but doctors can rule out some disease processes or stuff like that with some brain tests, but cannot be for sure until the patient has already passed away. And then if the doctor suspects that the patient does have CTE, he can recommend some treatments to do, as say before, pain management treatments, behavioral therapy, and memory loss exercises, so the patient can live a painless, well, I won't say pain-free, but a life that has less pain and more memory. And there is no known cure at this time, and CTE is a relatively new area for scientists and physicians. That's why there is no cure at this time and no way to treat it without the patient passing away. So in a face-to-face setting, I would ask some questions, as in what does CTE stand for, which is chronic traumatic encephalopathy. What is CTE? A degenerative brain disease. How is CTE diagnosed? Doctors check the brain after death. And then a true or false question. Athletes with longer careers are at most risk for CTE, which that is true. There are 3 signs and symptoms of CTE. You got mood changes, memory impairment, and poor judgment. True or false? There is a cure for CTE. That would be false. Then 3 ways to help someone with possible CTE to help their everyday life: memory exercises, behavioral therapy, pain management therapy. And then how many stages of CTE are there? 4. True or false? Stage 4 is the most severe stage of CTE, which is true. And then what stage does memory loss start? And that would be stage 3. So to evaluate the effectiveness of the teaching session, in a face-to-face setting, I would document how many questions people got right. I would then document how many questions people got wrong and compare what I found. If most people got most of the questions right, then I would document that this teaching session was effective. If most people got the questions wrong, I would document that this teaching session was not effective at all. And if it was effective, then I know that the participants have comprehended and they understand what I taught.